My name is Noelle Hanrahan, and this is the Women's Desk on Newsroom. We're joined today by Dr. Kay Taylor. She's the founder of Prevention International No Cervical Cancer. Thank you so much for joining us.
Thank you. I'm so glad to be here.
Tell me about cervical cancer for women in the developing world.
Well, you know, cervical cancer here in the United States is such a small number that we don't realize how terrible it is elsewhere. It's the #1 cancer killer of women in the developing world, in Asia, in Africa, in Central and South America, and 300,000 women a year die of it every year.
It's preventable.
That's exactly right. They don't have to die. It's totally preventable.
And how do you do that?
Well, in the third world, there's 3 problems really that keep them from getting the care that they need to have it prevented as we do here in the States. They don't have access because they can't get from their remote locations to where care is offered. There's not enough doctors. Most of these countries have a real problem with enough providers to provide health care for them. And there's just not enough money, either in their budgets, national budgets, for the preventative health care they need, and not enough money for the people who tend to live on $3 a day to get there.
So you take teams of doctors from here and volunteers, other volunteers, create a mobile unit and go see the women wherever they are and give them treatment. Talk to me about the see and treat care that you provide to women out in the countries.
We figured out, now that the equipment has gotten smaller, that we can put everything we need, essentially a mobile gynecology office, in 3 suitcases, plus a little tank of gas that we use for freezing, and put it in the back of a 4-wheel drive truck, sometimes including a generator, because we need electricity for our surgical loop removal equipment. And we go wherever these organizations need us. We work with women's clinics or women's organizations that help women with AIDS or women who've been prostituted or abused.
Where have you gone recently?
Well, this was a very busy fall. We were in Africa, in Kenya and Zambia, and came back for a couple of weeks, and then we were off to Honduras, Cuba, and Nicaragua. So we spent almost 3 months traveling.
Tell me about the case of Sandra.
Oh, this is this very dear woman who we saw on our very first trip, which was a 1.5 years ago. And she had a pretty severe lesion, dysplasia, which is the precursor for cancer, which we removed. We come back every 6 months, both to follow up patients and to see new ones. And when we returned, they said they could not find her. And it turned out the poor woman had been gang raped and was so terribly traumatized and ashamed that she had simply left town, disappeared. And I was really sorry because I wanted to make sure she was free of the disease. Well, the last time we were there, just last month, they found her. She had come back, and she came in, and we checked her. She was disease-free, and she was so thrilled to see us. She came up and hugged me and put her hand over my heart, and just said, "Muchas gracias."
Now that's the kind of thing that people can experience if they go with you. Who can go with you, and what does it take? Like, how much money does it take to actually do this amazing work? And you're really the only person doing this.
There are a few others doing similar things, but they're mostly stationary in one place rather than being able to go to remote areas. I mean, we've set up in classrooms, in clinics, in people's bedrooms. So anyone can go with us. I am recruiting gynecologists and nurse practitioners and family practice docs. And we also take nurses and counselors and even students. We have some pre-med students, medical students who come with us, and they learn our techniques as well. But there's a lot of tasks that need to be done, not just the medical part.
And while you're in there as well in these countries, I saw a picture where you were teaching a whole group of medical professionals how to do this technique as well.
That is exactly what we're trying to do, is to spread this technique, which was developed by the Alliance for Cervical Cancer Prevention through WHO. Bill and Melinda Gates funded a very large 5-year study that showed this is more effective than Pap smears and then following up with multiple
Now,
appointments.
some of our audience might have heard that there's a vaccine, but really tell us what the conundrum is with the vaccine quickly.
Oh, the vaccine is going to be wonderful in about 25 years in these countries. It has to be given prophylactically to young girls or women who have never had intercourse so that they can't been
So
exposed.
the whole pool of mature women is not counted in this.
Right. It's going to be 1 or 2 generations before we see the preventative effects. And even then it only hits 70% of the strains that cause cancer.
Where are you going next?
We'll be back to Africa in February, Kenya and Zambia, and we're going to add Tanzania this time.
And so how can people contact you if they need to get in touch with you and come on this trip?
Our website is www.PINCC.org, PINCC, and our phone number and email is on there, but if you want to write, it's ktaylor@pinc.org.
Well, thank you so much for joining us, and I'm sure we'll follow up with you. It's a great project.
Thanks a lot.
This is Noelle Hanrahan. This is the Women's Desk on Newsroom.